Presentation, I will talk about COVID and SMS, a case study in community pharmacy in Portugal. In terms of organization, I will start with a brief introduction, a summary of literature review, present a methodology, a case study, and data analysis, and I finalize with the conclusion and a future research. A brief introduction. The COVID-19 pandemic affects the whole world and changed the way we communicate with each other. The health sector was no exception. In fact, it was the epicenter of the catastrophe. Both in Portugal and the rest of the world, digital communication took a new prominence. It had already imposed itself as a way to reach a considerable group of people, but it gained a new dimension. The pressure that COVID-19 provoked was particularly felt in the health sector. On March 12, 2020, in a communication to the country, Prime Minister António Costa announced several preventive measures to contain the infection by COVID-19 in Portugal. This research debated the new digital communication in community pharmacy in the context of lockdown and understands how the pharmacies distribute their resources. This is the object of study with special focus on short message services. This research aims to contribute to a greater knowledge of what happened in digital communication in times of COVID-19 in community pharmacy in Portugal. In literature review, same digital communication information. Communications is considered a critical tool for stakeholders. Digital communication describes any electronic transmission of information that has been encoded digitally and transmitted via digital media, and its content accumulates, develops, and changes over time, and this data can be numeric, text, audio, image, or videos. Indeed, during the pandemic of COVID-19, people all over the world went into lockdown. It was social networking and digital communication that took evidence. In order to limit our field of study, as considered digital communication in COVID-19, and the health sector is defined to be all service provided by professionals who intend to preserve people's physical and mental well-being. Health communication, on the other hand, is any type of human communication that is content in related to health. So, it is undeniable that the study of communication in times of COVID-19 falls within this approach and that its rapid expansion presented an unprecedented challenge in healthcare communication. In this context, the most important factor is preventing the spread of COVID-19 was to convey to proper information to people. Healthcare professionals across all settings are now caring for and communicated with patients in the context of high uncertainty. Furthermore, social media are frequently used by healthcare professionals for the purpose of professional development. Also, in literature review, has important analyze the SMS and health communication issues. One-to-one marketing addressing customers individually. It's well established in marketing. Cell phones emerge and give origin to mobile marketing. This concept can be defined as using interactive wireless media to provide customers with time and location sensitive, personalized information that promotes goods, services, and ideas, thereby generating value for all stakeholders. SMS are a widely recognized communication methods in societies as the global penetration of the technology approach 100% worldwide, belonging to the first and most successful forms of mobile data transmission. SMS advertising was also reported as a very effective communication media for marketeers, and in the future also it was rapid growth prospects. In this investigation, the case study methodology was adopted because it is the best when one aims to describe a situation in its context and when we wish to know the how and the why the contemporary events. Interviews, documents, and observations are the main source of information in case studies. To ensure the quality of the research, the main measuring criteria was adopted: pattern matching, the use of multiple sources of evidence, and the establishment of a chain of evidence, a study protocol, and a database with the registers of all evidence. In this study, the chosen source were interviews and documents, with a total of 3 interviews and 208 documents and videos. 22 SMS sent to the customer's database. The data collection occurred in 2021, between September and November. A database was created and resumed every document coded with pharmacy information, publication data issues, and consulting data. This case study is about Central Pharma Group, CPG, with 3 pharmacies, a home delivery service, a laboratory to produce the compounding medicines, a service to provide institution with medication, and an investigation and research unit. CPG has an extensive database of more than 41,000 customers in the 3 units, which is a critical tool in this investigation. In the first lockdown, communication had no legal restrictions to point out. However, every interview response, speed, and pressure felt were the biggest professional challenge during the pandemic. CPG adopted a strict informative communication policy, releasing only official information in each one of its communication channels. Commercial and product communication was suspended between March and April 2020 and gradually returned in May. CPG SMS are managed through a customer relationship management software. This tool has developed given the pharmacy's needs, and it can manage in an efficient and real time the marketing and communication campaigns to the customers. The main SMS issues are centered in shadow information that change constantly in order to follow legislation. When any product information was released, it has centered on the necessary good during the pandemic, such as gloves, alcohol gel, and surgical mask. Furthermore, as one of the interviews said, SMS were the main support of communication in pharmacies. Besides social media, it was the cheapest and the faster way to get to our clients. It was needed to reach the biggest number of people in the last amount of time. Furthermore, never a company had sent so many SMS in such a short time. Carefulness in the writing tests in order for the message not to be interpreted as aggressive by no one at a time where there was so many disinformation. For that reason, the messages were longer than usual, almost always surpassing the 160 characters mark. This is the maximum of allowed characters by the telecommunication operators in order to only pay one SMS sent. In the second lockdown, CPG communication followed the same path as the previous one, keeping it essentially informative, releasing information in many ways similar to 2020. The main difference was that all advertising activities has been forbidden. Furthermore, the marketing budget was mainly concentrated in the digital media, having this been the main CPG investment to date. Regarding the SMS, sent more than 180,000 messages, and the total amount invested was 12,000 euros, being twice more than the last 2 years' average in each of the pharmacies. As main conclusions, we can state that the data indicates a complete digital transformation in community pharmacy. This change comes with an exponential growth in SMS investing alongside a more assertive and educational communication. Effectively, the 160 characters limitation on SMS make this form of communication difficult and attractive at the same time. Also, the CPG pharmacies felt this difficulty and had to increase costs by using more text to limit possible interpretation problems. This research has as main limitation those associated with the methodological option of case study that does not allow generalization to the population, as well as imply the limitation of time and space of data collection. The fact that the analysis is based only on a group of pharmacies. As future research, this investigation could be extended to other pharmacies that have developed communication actions, namely SMS, with this user to allow comparison of practice. I finish my presentation. Thank you for the opportunity to present my research. Thank you very much.